I'd like to call to order the September 10th meeting of the opening for the public meeting of the Suffolk City School Board. We'll go to work session topic 2015 and 16, goals and objectives. Dr. Whitney.
Thank you. As you well know, during our last meeting, during the retreat, we presented last year's goals and an update on our goals and objectives. As we've talked about before, my recommendation is to keep the same goals, but to revisit the objectives. If you'll turn to page 1, you'll see that through page 4, I believe it is, I've included each objective as well as some recommendations as far as some of those objectives. Again, realizing that these are your goals, but the idea is to continue some of the growth that we've made, specifically with goal number 1, but each goal indicates a particular objective or amendments or changes or additions that I'd like to recommend. If I may, I'll start with goal number 1, which is improve student achievement and close academic achievement gaps. All 4 of those goals, I think, it would be appropriate for them to remain intact. I would like to suggest that we add a 5th goal, which is increase student successful participation in advanced courses. Specifically, we're talking about honors courses, AP courses, as well as dual enrollment. That's something that you all discussed during the retreat, and I think it would be a good measurable goal. Objective. Our task is to try to make everything measurable so that at the end of the year, we can actually see whether or not we've met that particular goal or to what degree that we've met that goal. Or I keep saying goal, objective under the goal. Other suggestions, and obviously you can go back to them, but I'll just share with you what my recommendations are for each one, if that's okay. Okay. Goal 2, which refers to provide a safe and nurturing environment. I think we have a good grasp of objective number 1 as far as providing quality facilities by ensuring all schools complete the custodial checklist, and you receive that on a monthly basis and will continue to receive it. So it's not a matter of no longer doing that, but I'm not so sure it's necessary to be one of our this year's goals, our objectives. I would recommend that we retain objective number 2 and number 3 listed there. That speaks specifically to, objective number 2 should be eliminated, and it will actually be included in a sense in the new objective, which is decrease inappropriate student behavior by increasing effective school-wide discipline with fidelity to include positive behavior support. And the reason I'm changing that, or recommending that we change that from the second objective, as some of you share concern, it could be very easy to decrease the number of suspensions, but what impact does it really have on classroom discipline or school-wide discipline? So I believe, our staff believes, that a more appropriate objective may be to decrease inappropriate student behavior by increasing effective school-wide discipline with fidelity to include positive behavior support. You'll notice that we didn't specifically name the PBIS because there might be other programs that schools are implementing, or it may not be the true PBIS, but something similar. And I'm adding an additional goal, objective, which is to improve staff morale. We've talked a lot about that, and we saw from the surveys that that's something that is a concern. We did have 52% of our teachers that feel morale is high, but when you have 52%, obviously 48% feels as though it's not high enough. So to improve staff morale would be added in that particular, under that particular goal. Goal number 3 on page 3 is to provide strong leadership for effective and efficient operations. Obviously, we're going to want to keep the first objective there that speaks to meeting the goals and objectives in our division-wide comprehensive plan, which is required by the State Department and is revisited on a regular basis. Remember, that's 6 years out for the most part. And we look at where we are this particular academic year, what we need to change as far as updating that. It's a living document. The new objective under this particular goal is to improve parent satisfaction with the transportation department. As you well know, that pretty much came through the surveys, that's not as good as we'd like for it to be. Parents aren't satisfied with that, so we need to put some strategies in place. I think it'd be consistent with some of the recommendations that the consultant shared with us during the spring, and I feel like it's an appropriate objective, and when we survey again at the end of this year, we'll be able to see if we indeed have met that objective. Goal 4, advance academic achievement through enhanced instructional skills gained by professional development. That's a pretty much a professional development goal. We do want to add one additional goal here, and that is specifically that we're going to provide, I don't think I've listed it here, we want to provide leadership opportunities for administrators and pre-service administrators. And the purpose of that is to really groom our own and prepare them for our administrative roles. That's not to suggest that all positions will be filled by in-house positions or personnel, but the idea is to better prepare our folks to take on leadership roles within our division. So that would be added as an objective there. It will be retaining objective number 1, but eliminating science and history. And when I talk about eliminating it, it's not a matter that it won't be a focus, but when you look at our SOL scores, we know that the 2 areas that have prevented many schools from being fully accredited fall under specifically English, but also math. So I think it's appropriate to keep that as an objective, and it's a focus on rigor, increasing the rigor, and providing teachers and supports and instructional staff how to improve and enhance rigor throughout instruction. And the 5th and final objective speaks to strengthening the collaboration with stakeholders and increase parent and community satisfaction. As you can see, we would retain objective number 1, which is to promote family-school partnership by providing more opportunities for parent involvement, education, and input. I think we did a good job with that with the surveys, but we want to continue those efforts. As far as objective number 2, my recommendation is to change it to increasing stakeholders' surveying participation to measure satisfaction. I think we had about 5,000 surveys, which is not a bad number, but I think the goal should be to increase that survey, because the more we increase the actual participation, the more data we have and can provide us more quality feedback to move in whichever direction we see is appropriate. And then the 3rd objective is to change it to establishing baseline data of parent and community volunteers in the schools. You all know that we presented earlier a volunteer electronic program where parents can sign up. We don't have any baseline data right now to say how many parents or community members are volunteering. So this objective, probably not as measurable as the others, but I think we need that baseline data to collect the data, see how many volunteers we have. I think from the time of implementation, we have about 2,000 volunteers in the database. Our objective here will not only be just to increase the number, but obviously to match them as to where they'd like to volunteer. So once we have that baseline data, the following year we'll be able to see where we might need to increase it, whether it's specifically at a particular school, a school level, or a grade level, or whatever the case may be. But that's the objective for that particular goal. Those are my recommendations. Obviously, we can see where the need may be to focus on some other items or to include other objectives, but as you had directed me, I looked at our survey results, and this is what I've come up with, my staff and I, as far as what objectives we think would be appropriate for this year to focus on.
Okay, at this time, we'll go through each goal and ask board members if they have any suggestions, questions, or recommendations. Let's go back to goal 1, please. Looking at improve student achievement, close the academic gaps. You have the objectives in front of you. Any questions, concerns?
I just saw drop the percentage. So what would we put there if we're not looking at a percentage rate?
When you talk
a rate,
you're exactly right. When we talk about graduation, a completion index, it's an index. It should never have had the percentage up there. So that's a matter of, it will remain 85, but it's not a percentage. It's the index number.
Okay.
Yeah.
Other questions, concerns? Can we accept goal number 1 then with it?
I have a question. Are we going to get an update on our recent AP and honors and so forth? Are we going to get
we did during the retreat, but we can present that again, or if you want another hard copy of You're talking about participation?
Maybe I've forgotten.
Well, are you talking about, you know what, I apologize. If you're talking about the pass rate in AP,
Yes.
we didn't share that.
Yes, I mean,
Okay.
how we stand.
Yes, we can share that.
Because I've been reading a lot statewide, how
Sure.
people have improved and what they're doing to, make those improvements. I'd
Update
like
on the
to see.
results, and those results generally are, did we present that or not, Jackie? I'm sorry.
Right.
Okay. When do we normally have that information? Will be presenting, Dr. Davenport will be presenting the timeline as to presenting that information. But
Okay.
yes, we can present that.
I just had a question about that.
Anything about goals and goal 1 and objectives for that goal? Goal 2, let's go to provide a safe and nurturing environment.
I have a question.
Go ahead.
Since the time that I brought up some issues about the cleanliness of our schools, and I supported some type of a checklist. I also heard, I don't know whether it's true or not, that those checklists were not properly submitted, and so it wouldn't have done any good if they weren't properly submitted, which I don't know. But the other thing is, has there been any coordination of custodian? Has there been any change since that time?
Yes, there has been. In
Okay.
fact, again, during the school board retreat, and it was in narrative form, we didn't go over it verbally, we had an update of the findings, or I guess the progress, once we named a custodial supervisor. And as far as the actual custodial sheets, they have been submitted on a regular basis. In some cases, when you look at your school board material, you may see a hole. It's not a matter of it was not submitted. It may not have been submitted before this packet was put together. We think we have solved that because it's now done electronically, so they submit it themselves as opposed to it still could possibly happen. But I do believe it's made a difference. In fact, one of the things that we saw the proper use of materials and supplies, because there was some training that was done through the supervisor. In addition to, we saw a decrease in the supplies because there was closer management of those supplies. And I can say this, we've had more on-site inspections than we've ever had before, as far as looking at that particular checklist from an outsider coming in saying this is what's needed or what's not been done as well. So I do think that it has made some progress. In fact, if you'd like, we can present that. Again, it was in narrative form, but we can present the progress specifically if you'd like.
Well, I don't personally think that's necessary, because I think that when various people go into schools, they'll be able to tell whether there was real progress there. I was just curious to know how you were coordinating it. That's all. I don't have any specific objections.
So you're suggesting that we keep the monthly custodial checklist, we just won't include it in this?
Absolutely.
Okay.
Right. No, we definitely would not discontinue that. It's just
Right.
not an objective, I think, under this particular goal now.
Okay, thank you.
Anybody else? Goal 3?
Oh, I'm sorry. Going back to goal 2, could I ask one
Sure,
other?
absolutely.
I know that when you have objectives, then after the objectives, you have, well, how you're going to do it.
Yes.
Well, I was just curious to know, and maybe this isn't the right time, but how do you plan to improve staff morale?
Well, there's a number of things that we've done. In fact, I think some of the initiatives that we've done already, the wearing of jeans, the teacher resource voucher for school specialty has increased it as well as problem solving and just opening up dialogue and let teachers decide. Because I think when we talk about morale, it's not just the top coming down, it's really those who are working in the environment as far as feeling satisfied. I think a huge piece of it also is empowering our teachers and staff members. And we're going to do that by requiring teacher advisory councils at each school, which in turn, one of those representatives will serve on my advisory, which I've had in the past. But they can address some of the issues and concerns that might be decreasing or not increasing morale as well. So those are some of the specific strategies, but you're exactly right. For each objective, there'll be specific strategies to do that.
Okay.
I think the whole presence of central office serving as a support as well. In fact, I met with some staff members today and talked about the presence that we've had over these last 3 days to continue that throughout the year, so that folks can see that we are support for you. It's not a matter of pointing out what's not being done right, but it's a matter of, if it's not being done right, how can we support you so that it can be done right, and so that we can, make sure students are working to their potential. So I think when we talk about morale, it's really a matter of making sure that the working environment in which you're in is you're feeling good about coming to work each day, and also that you're empowered, and some shared decision-making is taking place as well.
And speaking about morale, I was impressed with morale on the opening day of the convocation. And we have to be careful about, in my opinion, about morale and not allowing one or two people to set the tone for the majority. Because you can have 2 or 3 people who are dissatisfied about something, and they can create a lot of disturbance for the other majority, when morale may not be a problem, but it's a morale for 2 or 3 people. So they want to make it a morale problem. But I was very impressed with the morale factor, and I think that I was sure that some other board members saw the same thing when we had that meeting, that we have to be careful about 1 or 2 people having gripes at the expense of the majority, if I'm getting clear.
I thought Dr. Whitney's dance was unique. Wasn't
Yeah, I
it?
thought that was very
I did,
good.
yeah.
And I was very impressed with the entire operation, to be honest with you.
I saw it on YouTube.
Thanks for sharing that.
I'm
Gee, I
just
wish I'd seen
thinking, I'm just thinking that the decrease in inappropriate student behavior will be a contributor to positive morale on the part of teachers in the way that we deal with issues that disrupt the instructional environment. I think teachers want to come to school to teach, and it's a much better environment, and you get to do what it is you plan to do and what it is you're dedicated to do if we can eliminate these aberrant behaviors that seem to be a distraction.
Interestingly enough, I also saw a slight correlation with student performance and morale as percentage of high morale. In other words, if student performance wasn't where it should be as far as benchmark, then perhaps morale wasn't as high as well. So I think as we perform better, when I say we, I'm including myself as well as every teacher, as far as making sure students perform better, we're going to feel good about what we're doing and where we are as well.
Also, I think a lot of the schools individually are working on that very idea. I know all of us probably received the invite from Booker T where they had a day, a dinner or whatever, a luncheon or whatever. More of that on hands right in school is going to lift the morale as well. And I think we should encourage those things. Yes, in-house, the principals know what they need to do.
I think the biggest encouragement is going to be through the advisory committee being involved in the different activities that are going on in the school. And I think the teachers will get involved in that, because it's a known fact that teachers want to get involved. Now, that committee will be chosen by the teachers, will it not?
Right.
Not by the principal or...
In the past, we have had the Teacher of the Year, but that doesn't mean it has to continue to be that way. I would suggest that we actually let teachers nominate a person that they think can best represent them as a teacher group.
Now, how many people will be on... Excuse me, how many people will be on the school advisory committee? 5, 6? What number will be on the school advisory committee?
Generally, it's a teacher from each grade level, or on the elementary level, middle school grade level also. And when we get into the high school, we start looking at content areas and grade levels. We don't want it too large, but obviously we do want a cross-representation.
And you'll have one of those teachers from each school that...
It'll be one teacher and an alternate that will serve on my council.
Okay, good.
Yes.
All right.
One teacher from each school and an alternate that are, okay.
Yes.
Goal 3, provide strong leadership for effective and efficient operations. And objectives, goals and objectives to meet the citywide comprehensive plan, school improvement plan for next year. Any questions there?
Dr. Whitney, to go along with the new objective, since the report on transportation in July and Mr. Doey's presentation in August and the parents' survey results, I've been looking at, and I would like to see if perhaps we can explore outsourcing school transportation. I've got a stack of research here that I've done. The latest American School Board Journal had an article called "School Transportation Outsourcing Tips," and they talk about how these companies can do it without reducing reducing the employees that are locally hired by just taking them on. I know when outsourcing was discussed previously, the custodial force thought that their jobs were being attacked, but the companies look to hire the people that are working as long as they're meeting performance objectives. And I'm just concerned that perhaps it's something we need to look at.
Could I ask you a question about that, Mr. Mitnick? I know that in some situations, the problem came down to the fact that to outsource, you had to give up your buses. And then if that didn't work, if the outsourcing didn't work, then you have no buses. That was the only thing I had been concerned about.
And that is, I have some negatives in here as well, and that certainly is one of the
Okay.
negatives.
Yeah, it's worth looking into.
But I think it's based upon everything we've had before us in the last couple months. I think it's something worth looking into, and I'd be happy to serve on a committee if one is formed.
Goal 4, advanced academic achievement through the enhanced instructional skills gained by professional development. 2 objectives there.
Question with regard to eliminating science and history. Are we eliminating them so we can focus on math and English and more, or why would we eliminate those subjects? I mean, even though we're probably doing whatever, those subjects, I have this thing about focusing on something, but I think those subjects are just as important as others. So help me with what our rationale is.
The intent was not to eliminate it as far as it still being a focus. When I look at this goal sheet and objectives, it's going to be what are we focusing on? And that area, again, was English and mathematics. To leave it there would not be an issue. Obviously, we still know that English and math, we have historically done much better in science and history, and will continue to put forth efforts. But as far as keeping it, that's something that I'm sure we can do. If you want to keep it as an objective, we certainly will, with English and math still being our primary focus. And I certainly hear you, because I think that comment or that idea came up when they talked about eliminating some of the SOLs in science in particular. Was that going to be left out? That certainly wouldn't be the case here, but it was a matter of what's going to be our primary focus as far as this particular professional development. If there are limited funds and we have to choose, what are our priorities? And it would be math and English currently. Again, with not necessarily saying we would not still have an eye on and focus on science and history.
My only thought would be that, just as you said, if there are limited funds, then our primary focus would be on math and English, because that's what we're measuring most often. However, I don't want anybody to feel that these 2 areas are less important with regard to a total education than other subjects.
Hey, look, they don't even mention foreign language.
I know, and I thought about that when I looked at you. I thought about foreign language and
We
the
can
arts
certainly
and
keep
the other
it.
things.
What's your pleasure, board members?
I would be in favor of keeping it in there and adding foreign language if necessary.
Oh, no, that'll
if-
never
if-
happen. I understand that. But
Well, if it's important.
it's important, but just as Dr. Whitney said, what I believe you're actually saying is, we're going to focus more on anything that's slipping. And if we have 5 people to work on it, and one of them and one area is slipping, then that's,
And you focus on that area.
That's
And
what-
I
that's his
thought,
point,
is,
I think.
can we word it just so that we'll say we'll give priority?
priority
Priority
focus.
That's a
Priority
good
will
idea.
be
Yeah.
English and math.
But
Because
still
certainly do.
keep science and history.
We can do that.
Anybody else? Goal 5, strengthen collaboration with stakeholders and increase parent and community satisfaction. 3 objectives.
you're in goal 5, right?
Yes.
I have a question. I think that the one area that needs to be strengthened in the volunteer program is training for office staff in each school. Because it's, when I say training, I mean when a potential volunteer calls or comes to the school, then I believe that the person they first see should embrace them. And I don't know, I'm not going to say that doesn't exist. I don't know, but I just think that that's where, you can have all these lists that you want, but if someone comes up to the school and they're not warmly received, then it doesn't matter.
And that might fall under, I'm thinking that might be a strategy when we talk about obtaining that baseline data. This is how we're going to do it, by training the office staff, by training folks within the volunteer electronic system as well, making certain that we don't just have this list of volunteers and they're not working. It's a matter of when they do come, we're going to put them to work and get them to feel welcome so that they'll come back and be a consistent volunteer as well. So.
I know this is just one example, but a lady called me the other day, an elderly lady, and she said that she and her friends really wanted to come in and help. I think they were particularly talking about Florence Bowser at the time, but that's just an example.
Sure.
And again, this isn't about Florence Bowser, but she said that the problem was that they didn't feel that they were well received, so they didn't know. I said, well, there are a lot of things that we would love for you to do, but she felt that there was some disconnect there
Right.
from what they had to offer and being received. And once again, she wasn't complaining about Florence Bowser at all.
Mm-hmm.
She just was saying that was one of the places that they wanted to help.
I would agree with you. I've had some parents or not community members say, I really want to offer assistance. How can I? And I'll say, well, I know this school needs this or has talked about this. But again, I'm hoping that the system, because it matches people specifically, but also making sure that that personal invitation, that personal interaction is going to enhance it to where they feel welcomed and also accepted so that they'll continue to do it. That's the way I see it growing.
I think that's critical because I too have some of those stories. I know that a math consultant that's paid by the state came to volunteer. She retired and lives in a neighborhood very close to 2 schools, came to volunteer to help with math and was turned away in both situations. And I'm thinking, okay, giving it for free. And
The burden of that goes on the principal, letting the principal tell their office staff what their needs are and how to approach people.
We can certainly do that. And when we talk about the training for office staff as well as administrators on making sure they're accepted and welcome.
Else concerning goals and objectives for the plan? Do we need to, we don't.
I think you do, you could, and because what we can do in turn is I tell you what, why don't we create a good copy of this and bring it back to you during the next board meeting?
I do have a question, Dr. Dobransky, with regard to the superintendent's evaluation. We created it last year, but we haven't ever done it. We haven't ever used it, so I don't know when that goes on the agenda, but I thought I'd bring that up as we talk about goals and objectives.
Okay, let's go to next issue.
All right. We have a health insurance review to basically share with you an overview of our self-funded health plan for our school system. I'm going to call Ms. Wendy Forsman, our Executive Director of Finance. Ms. Forsman.
Good afternoon.
Good afternoon.
We're going to talk about a little bit about our self-funded plan, and I'm going to give you some information about the plan itself as well as some strategies that we're using. There are several advantages to a self-funded plan. Obviously, there's no premium taxes to the state on medical premiums. You have lower administrative expenses to the healthcare folks. You have greater flexibility. We can design our program the way we want it designed. We retain savings when they occur. So in a year where actual claim costs are lower, instead of the insurance company keeping those dollars, we keep those dollars. And so in fully insured plans, if you're fully insured, on those years where the claims are lower, the insurance company keeps that profit, okay? So those are the advantages to having a self-funded plan. There's several vocabulary terms, and I won't read these slides to you, but I want to just point out to you some of the major ones that folks make a mistake on. Covered members, when I talk about covered members, or anyone talks to you about covered members, they mean all the employees plus all the dependents for those employees that are covered by the health care. Not just the employees, but all the dependents as well. So when someone talks to you about covered lives or covered members, that's everyone who's enrolled, employee plus dependents. Stop loss coverage, when we start talking about stop loss coverage, that is real insurance. And what that insurance does is it covers large, unexpected, single claims that cost more than a specified amount, in our case, $175,000. So we have an insurance so that a single claim gets higher than $175,000, this insurance kicks in and pays it so that we don't have a sudden bill for a huge amount of dollars that we don't have in our reserve to pay. And that's a good risk coverage. Utilization rates refer to the amount of medical services used by employees in a specific period of time, mostly a year, usually a year. Our plan year runs from October 1 through September 30th, so it is not a calendar year. It is October 1 through September 30th. So utilization is how often employees use the coverage to go to the doctor, have surgery, go to the hospital emergency room. So that's what utilization means. On the next slide, I'm going to talk to you a little bit about third-party administrators. Third-party administrators, there are two kinds. There are companies that handle the medical invoices that come in from all the different doctors and emergency rooms in the area. They review them, and then they pay them on behalf of the company, meaning Suffolk Public Schools, and then they send a bill. And then there are third-party administrators with a carrier, and what that is the health insurance network itself is the third-party administrator. That's what we have. Anthem is our third-party administrator. They receive all the bills, they review them, they check them to make sure that the coverage is correct and that they meet the network cost if it's in network, and then they pay those providers and send us a bill once a month for those claims. Administrative fees are what Anthem charges us for doing that service for us, and those are fees that are set when we negotiate the contract, and they're per employee per month. So they're a set amount of money per employee per month. Whether the employee uses the benefit or not, we pay that rate based on our contract with the company. And of course, you know, self-funded means the actual costs of claims is what we're paying, dollar for dollar. Here are the components of a self-funded program. There's the employee usage, which are all your medical claims, and as you can see, $14.7 million is the estimate for the current year. And that includes everything: doctor's visits, hospital visits, imaging, which is your x-rays and your CTE scans or CT scans and all those kinds of scans, surgery, pharmacy, physical therapy, everything is included in the medical claims. Then the stop-loss coverage insurance cost, $813,056. The administrative fees, which are $21.41 per employee per month, come to $376,131. Then there's a prescription drug credit. Because we use the network through Anthem, we get a credit on our prescription drugs, and that runs about $11.38 per employee per month as a credit back to us. If we were to go on our own for pharmacy, that would go away. Not a lot of money, $199,924, but you just need to be aware that that is given to us because we use Anthem. Then there's a state tax on the stop-loss coverage that we purchase, that insurance, and that is $18,294. So the estimated cost this year is $15,515,178, but those are the components that drive that number. The ways that you can contain costs, as you can see, the largest number, $14,507,621, the only way to reduce those costs or contain those costs is to involve employees in their health care, which is wellness, or to change the plan design, which is to drop coverage, or shift costs, which we did in 2013. If you'll remember, we increased co-pays and we increased the monthly amount that the employees have deducted from their checks to have the coverage, or to manage disease costs through some method of disease management counseling. To lower the stop-loss coverage amount, we can increase the risk. We can move that from 175 to 225 or 250 or 500. You can move that number, and the insurance risk to the insurance carrier goes down, and then the cost of the plan goes down. But you increase the exposure for the school division, because then it's higher and higher paid claims that you'll end up paying before you hit the stop-loss coverage. And then the administrative fees. The administrative fees are negotiated with the vendor every time we negotiate the contract, and we get them as low as we can for the coverage that we're looking for and for what we want from that vendor. So those are negotiated every 5 years. For our trends, this is kind of a busy slide, I apologize, but I was trying to get a lot on this one particular slide. You can see an 8-year history of our health benefit cost. In 2008-09, $9.8 million was the claims cost that year. As you can see, the estimated is about $15.7 million for 15-16. If we look each year individually, you can see where from 2008-09 to 9-10 it was a 6% increase, and then each of those percentages between the bars shows each year how much the cost of the claims increased. And you can see that's quite a bit of increase over those years. So in 5 years, from 2008-09 to 2012-13, it was a 61% increase in cost to Suffolk Public Schools for the health benefit. So that's $5.9 million that we had to come up with in order to cover those costs during those years. If you look at from 2013 to 2015-16 estimate, you can see that we've taken some steps, and it's pretty flat. We've stayed about the same. So we haven't had that huge increase that we were seeing before. And we've taken several steps to do that. One, we made some change in the benefits. So we shifted cost to employees, and we changed some things that we covered. And then there was an enrollment change. We changed the enrollment. When we did some of that, the enrollment of employees went down. So employees who would have had the plan with us either decided it was more beneficial to go on their spouse's plan, or their spouse had a better plan, or whatever they decided, and they shifted off of our plan.
Now, if I may interrupt at this point, when you look at this slide here, when you look at 2012-13 to the estimated 15-16, you can see that we've been able to kind of contain the costs. And I think it's important to talk about that term versus have we saved money. It's not a matter of saving, it's a matter of containing at this point, because we can see within a 5-year span the increase of 61%. So looking at, again, 2012-13 to estimated 15-16, we've been flatlined, which is a good thing. We've contained costs versus using the term saved money. We haven't saved money.
Saved money, but it has meant that we haven't had to increase the budget for covering this in those years, which is huge.
Of our employees' cost, it goes towards this $15,515,178.
Employees pay, it depends on the coverage that they have. For employee only, we cover about 90%. For
Question is, how much of that goes towards the total cost of it?
the whole amount that the employees pay and that we put into it goes to this.
How much do they pay and how much do we pay?
It depends, again, on the coverage. If they have employee-only coverage, we're covering about 90%. If they have employee family or employee dependent, it runs around.
So average, I guess you're saying of the 15 $13,700,000 of the $14,700,000, what part of that does the school system come up with? And
All
what
of that.
it would average about 86 or 7%.
So, right.
The school comes up with, and the employees average pay the other part.
And remember, this isn't the part the employee pays out of pocket. This is only the portion we're billed for. Okay? So this is their deduction on their monthly paycheck plus what we put in each month to cover this amount of money. That isn't what they pay out of pocket. It's not what they pay directly to the doctor. It isn't what they pay in co-pays or deductibles or any of those things. This is just what we have to cover.
So in other words, they pay a part, we cover a part, but that still means that they're paying other costs when they go to the doctor's office.
Absolutely.
If the deductible is $40 when they go to the doctor's office, then they come up with that in addition to the part that they pay for their insurance plans. Okay.
Now, our last 3 years have been at the same level roughly, right? Is that correct?
Yes, sir.
Now, if it were to spike up because of some type of injury or unforeseen accident, we have a reserve fund to cover some of that. Is that correct?
Absolutely. And again, we have the stop loss coverage if it's really large. So if you would think about a cardiac care stay. If you have someone who's in the hospital 11 days, how expensive that can be. Well, if it gets to the $175,000 mark, our insurance kicks in and pays anything over that. So that's why we have that stop loss coverage for that risk of something catastrophic happening.
So it's not for, say, one event, but it's, say, one employee that,
An employee's event.
yeah.
Yes, ma'am.
Or one employee's multiple events, right?
No,
Like if-
single event. So
Oh, okay,
single
11 days
event.
in the hospital is a single
Yes.
event.
Yes, ma'am.
Okay.
There are multiple things within that event, it'll all be covered as a single thing. But if they have something happen today and then something happen 3 months from now, those are two different events, and they won't cover that way. Okay? Is this slide okay for everybody? I know it's a lot on this slide, so I want to make sure everybody understands. Some enrollment trends and some things that are important for us to all see and understand. In 2013-14, we had an average employees of 1566. In 2014-15, it dropped to 1488. As I said, some enrollment changes during that time. The expense per employee, if you take the total employees and divide the total expense, for 13-14 was $8,946. In the next year, it was 8,605. So that's a good trend. You want that trend. You want things to go down. Because in the medical field, as you know, things are exponentially increasing in cost. So it's nice to have that where it comes down. Even if it means that we've enrolled less people, we still have less costs. So there's a reason for the cost going down, but it's nice to have that. The average per member, which means all the covered lives that we talked about in the vocabulary, those went down as well, not as much, but those went down as well, and the expense per member went down 6.3%. Some interesting facts that kind of help dig into this a little more. The average number of members we had one year was 2719, and the next year 2651. Again, a 2.5% decrease. The average members per policy, that's a different thing, number of people per policy, on average, went up from 1.74 to 1.78. So we
What
have more
percentage of-
dependents.
What percentage of our staff is requesting hospital?
We have a little less than 2,000 staff. So that's most of our staff.
2,000, so
Yes, sir.
500 aren't approximately.
They may have coverage elsewhere, whether it's with a spouse or military or other ways of having insurance. Lots of ways they can have insurance that isn't through Suffolk Public Schools.
Percent of our staff is requesting insurance.
Average age of our employees is about 47 point. Not a young group. Average age of our members, and this includes all the dependents, is 37.92 years, which again is not a young group.
Would that have any effect on the cost?
Of course, absolutely, absolutely. As we age, we need more services.
Well, that's what I'm asking you.
Yes, sir.
Yeah.
Yes, sir. Absolutely. This is why I'm providing this. You can see that our group is not young. I won't say they're old because that's really not old, but they're not young either. They're not children. They're not 12, 15, 20, 25. You're looking at people who are covering themselves and their spouse, because you're looking across all policies. We have mostly employee only, but those employees who are covering dependents, that average age is 37.92.
But you have to, I think we have to look at the fact that you said that they're not old and they're not young, but these are the individuals who have given their life, in many cases, to the system. And so they deserve something from the system. After all, they were young one time, and it didn't cost the system a lot of money. So now, since they're 46, they might
Time to take care of them. Yes, sir.
That's right. I mean, you don't have your cake and eat it too.
On the other hand, the HR department may want to look at hiring much younger employees. They don't talk about that, but
Get in experience.
yeah, but
Okay.
they spend less on insurance.
Remember,
I
these
think-
are
I
averages.
believe one of those things might be called age discrimination.
I know,
You
exactly.
can't just hire younger people and say, you're cheaper, so we're taking you. I don't know, but,
Yeah.
yeah.
And again, these are averages. These are averages.
Yeah,
So.
keeping in mind their averages, but also keeping in mind at our new teacher breakfast recently, only about 5% were new teachers out of
That's
college.
right.
These were transferring people. I think people are willing to move now from one district to another district, which in turn means that they're going to come with some years of experience and in turn will be older.
Shopping around.
Some other trends, if you look at the types of care, inpatient, outpatient, inpatient professional, outpatient professional, pharmacy, you can see we've had some areas where we have had a percentage of change between the years, and that's a dollar percentage, not the 29% to 25%, but a dollar percentage of 21.2% decrease in outpatient facilities, outpatient professional, because the outpatient facility decreased, outpatient professional decreased. But you can see from this chart that 75% of our total claims come from outpatient, outpatient professional, and pharmacy. Those are our big areas where our folks use the services.
I'm reading this correctly, with the exception of pharmacy, those rates have gone down? In the
Yes, with the exception
outpatient
of
facilities
pharmacy,
and the
yes.
outpatient professional.
Yes. Pharmacy, as you know, with all the new designer drugs and all the things coming out, those costs just continually go
They
up.
escalate.
This list on the next slide shows the most manageable medical conditions. These are things that can be managed through diet, exercise, certain amounts of medication can control these, but asthma, cerebrovascular disease, chronic respiratory, coronary artery, depression, diabetes, high cholesterol, hypertension, and rheumatoid arthritis. These are our top most manageable conditions that we have in our
Those people that have the known conditions, are they aware that they should be taking the course that we're going to offer for them?
Well, we've made available to all employees the wellness program, and hopefully through that process, all employees will take advantage of that. And with that comes the what's it called? Consulting. It's not called consulting. Coaching. There we go. I'm sorry. The wellness coaching that will help an individual employee who has maybe diabetes and wants to manage it better. That individual coaching that comes with that wellness program will help them do that and do it very easily.
Our program that we mentioned during the retreat will come into play.
Absolutely. This is a great program that will help our employees become more aware of their health, become more able to manage their health, and give them a tool to help manage their health.
And the unique piece about that is that the plan can be developed individually for those persons' needs. In other words, if it's hypertension is an issue, again, the coach will help specifically design a plan to try to control that.
That person, that individual person. talk about containing the medical claims and how can we do that. Of course, the wellness program that we've been talking about can do that, involving employees in their own health, in their own health care cost, helping them understand those costs, that it's more expensive to go to an emergency room than it is to go to the regular doctor, how to improve their health and to manage their health better, and contain costs that way, because then you have less cost going to the doctor if you're more well. But you can also manage those controllable diseases better and not have catastrophic events at the end of those where it really is a problem. You can manage them on the front end and not ever get to the higher cost care because they've managed those conditions. Also exploring the pharmacy and getting medical claims for the pharmacy lowered and get them at cost. The plan year 13-14, we spent $3.2 million on just pharmaceuticals.
So that idea that we had of sharing, how far did that go with trying to do the drugstore thing that?
When we looked at it for individual organization, we didn't see a lot of we didn't see a lot of savings or containing. So we have talked about exploring it with the city if indeed they're interested.
It is not something feasible for us by ourselves. It's just there's not enough members to make it cost effective. It takes about $1 million to run one for a year.
What about going together with Chesapeake, for example? Did we look into that at all?
We have talked about it, and I think there's been some conversation with the contact persons from Chesapeake.
There has, and one thing that they're not ready to do that would not, until they do it, it doesn't benefit us to go with them, is to put a Western Branch location.
Right.
Until they're ready to do that, and they're not there yet.
Okay.
But until they're ready to do that, it really doesn't make sense for us, because our folks would be going way into Chesapeake in order to get their stuff, and
Right.
Would it help them if they knew that we were interested in helping them with the establishing something in the northern Suffolk area?
they're very aware that we're
Oh, okay.
interested, very aware that we're interested.
We're interested.
They're just not there yet. They're not quite there. And also exploring wellness clinics where an individual school division or school division city run a clinic where employees can go for things that aren't critical and see a nurse practitioner, which is much less than a doctor visit. It's run by the school division in the city or the couple cities together, however you run it. But it provides a way for people to avoid that emergency care or urgent care visit and see a doctor the same day, which a lot of times you can't do with your own doctor. So that's another way that we can look at exploring something to contain costs and help us serve our employees better and contain costs at the same time.
Roughly 30% less in emergency room at the hospital, is that correct?
Does Chesapeake have that wellness clinic?
Their pharmacies include a nurse practitioner
Right.
that runs a wellness clinic and disease management piece of that for them. And I don't know how extensive it is with them, but they're not the only person that does that. There are a lot of school divisions that are looking towards this. And then we get to talk about the Cadillac tax, which the word Cadillac, as you know, is not a real good term, but that is the term that the federal government is using. Their goal is to get revenue, if you will, from employers that provide rich plans. So they have set a standard for annual cost limits. So that is the total cost of the plan. It includes the employee portion as well as Suffolk Public Schools portion. For single, it cannot be more than $10,200, and for family, it can't be more than $27,500. McNeary, our insurance consultant, our benefits consultant, put together this for us so that we could see where exactly we're going to run into this. And the red highlights show you what year and where we're going to run into this tax. The way the tax works is if we have 100 policies, let's say the single PPO policy on this chart, which has $10,725 in the year 2018. Does everyone see that? We had 100 policies,
Yes.
and it was $500. At that one is $500 above their limit. You multiply that out, and you multiply it by 40%, and we would have a $20,000 tax levy that we would have to pay to the federal government in order to provide So they've detailed out each year what plan and when we will hit the Cadillac tax based on normal growth. And they did a growth at 4.5%, normal growth in our plans and where their costs are going to be. And so by the year 2021, for instance, we will potentially have to pay $155,312 if we leave everything the same.
How many people are presently on the Cadillac plan?
Now, currently, if we look at just the PPO plan, because that's where most of the red is, we have 211 employees on that plan today. And we have 129 of their dependents on that plan.
I'm sorry, I didn't hear you.
29 dependents.
129 dependents.
Like 10% or so? 10,
340, right? 340, 30. That's not a large group, but it is significant enough that we need to talk about it. And then, as you see on the top, the single HMO and the family HMO will begin to hit by 2020.
So even people who are on the HMO,
If we leave everything the same, if we don't take steps to reduce utilization, which reduces cost, if we don't make some changes to the plans and take some other steps, we're going to have this tax by the time we hit 2020.
It's part of the Affordable Care Act. Thank you.
so if it's going to change whether you have an HMO or whether you have a PPO, the persons who pay for PPO, I know I do with my own insurance from work, I pay more than other people who have an HMO. So it's not like I'm getting a big favor because I'm putting more into it. So even if people are on the HMO plan, and it looks like most of them are, we're still going to have to pay this tax at some point in time.
Either pay
And-
it or do something to avoid it.
Well,
Yes, ma'am.
If the things that we could do to avoid it would be like cost avoidance, we just shift some more to the employee, but for the employee and the employee's salary, it's still going to be, if we made them pay half of what they get, at some point in time, as the numbers increase, we still have to pay some tax.
If we increase the numbers, and that's where the wellness program comes in, because if we can decrease the cost through utilization, that $14 million, if we can keep that the same or decrease that by people becoming more aware of their health and understanding that they're really in a co-op, if you want. I mean, that's really what this is. We're all in a co-op, and everybody has a responsibility to the co-op. If we can help our employees understand that and help them become more aware of their health, we can contain those costs so we don't get to this situation. And so that's really why we're the big push for wellness and why we're really trying to work through this in several directions, because we really have to attack it from a lot of sides in order for this to work. So other school districts have done healthcare clinics, they've done pharmacies, and they have wellness programs that pay employees to maintain a healthy lifestyle because it's in the best interest of the school division. It's in the best interest of everyone to live more healthy. So this is what other districts are doing. So of course we planned and did the wellness program. We launched that this fall. We're exploring the joint pharmacy health clinics as a joint project with the city. And again, we're kind of waiting with Chesapeake because they're really not at a place where it's going to be advantageous to us. They will get there, is what they keep telling me, but they're not there yet, so we're not ready to do that. But those are some of the things that we're doing. And so we've got some next steps we'd like to discuss. We'd like to discuss the creation of committee to a cross-section of employees to explore offering several types of health care, including a high-deductible, low-cost plan that will give an employee an option, and also to make changes to the PPO plan so that we can stay away from the Cadillac tax, and make changes to the HMO plan so we can stay away from the Cadillac tax. Now, this will take at least a year to get folks together and train them to help them understand the complexities of how this works, and then begin to discuss what are the things that we can do. And so it really has to kind of start now if you're planning for 2018, 19, 2020, so that you can begin to look at those changes, cost them out, bring them here and have you approve them, and then get the communication out to the. It takes a long time for this process to happen, so we'd like to create that committee this year and get them to commit with us to work through this. We'd also like to get permission to explore the pharmacy wellness for Suffolk Public Schools and the city as a joint project to see if we can reduce costs for both of us.
When does this tax go into effect?
Tax goes into effect 2018.
So-
And we won't necessarily hit it at a great rate in 2018, but by 2020, it's going to hit us pretty hard. So we
Preparing for
need to.
2018 now, is what you're saying,
Yes,
and I
sir.
agree.
Yes, sir.
What about the percentage of, well, that's not what I want to ask. It'll come back to me, I was thinking.
That's really the end. I just, if there are any questions,
Do we
any
have,
further questions?
do we have contractual obligations on our health insurance now with a specific company? And it is until when, 2017 or 18?
2017, 18, yes,
Okay,
sir.
so we are contracted with that company for 2 more years.
Yes, sir.
Okay, thank you.
So we have to,
Mrs. Foreman, the wellness program, I was excited about it when it was explained as to what we're doing. But how do we get our staff to participate in it? You know, I've been in a program, and we were going to reduce our insurance in about 4 years by having the wellness program. So, okay, a lot of it was obesity at the place we were. And when they saw several people going to win prizes and they had lost so much weight now, I mean, they just fell off the wagon, just said, well, we're not going to win it, and we don't, keep it going. Is it a way we're going to impress upon those staff persons that if we were to try to follow a wellness program, in 2 years, your premium may drop? I mean, you could work at something like that.
Yes, you can work it, and that's why we started with incentives this year with the Fitbit in December. If the employee meets a certain number of points, and then the $200 in June if they meet the certain number of points. The company that we're working with, Vivere, is actively involved with us in looking at this on a weekly basis. How many people have logged in? How well have we communicated? Who's completed their health assessments? Who's signed up to get the biometric screenings? Every week, the group meets to discuss where are we and what can we do to improve. And every year with this company, we can choose to add and change and tailor our plan as we move forward in wellness. Each school and department has been asked to appoint someone to help promote the program. So each school and department should have someone who's helping us promote that program. There's all kinds of communications that Dr. Rice and her staff are working with, trying to get out to employees through email, right? Emails and flyers and all kinds of things to help everyone become involved in it. And hopefully we can continue the momentum of incentives for employees to understand how important this is to us. It's got to be a cultural change.
I think it's important for the person to understand that it's for a health reason as well.
Absolutely.
It's not only because of trying to save money, but it's trying to save a life. And that we need to try to drive that point home, that it's for longevity and a lot of other things that you need to consider. Of course, I know a lot of people, especially those who need it, they'll blow you off, and that type of behavior. But if we can encourage the employee to be aware that it's a health factor, and down the road it would also save lives as well as save additional dollars, not having to buy medicine that normally certain behaviors incur.
Any final questions?
What you need as well as far as our permission to continue working with the city. Is it a vote?
I don't think it's really an
just a
action
nod
item. It's
that-
just a matter of you all
Okay.
agreeing. consensus.
With regard to working with the city, our subcommittee, that is one of the things that our subcommittee recommended that we look at that. However, what we found is that our plans are far apart with regard to our needs as a school system and their needs as a city system. At least that's what their representative indicated when they met with us. And I think Mrs. Skeeter, you were there at the meeting, and that was what their representative indicated to our subcommittee when we talked about insurance. It doesn't mean that we're not going to continue to pursue it. As a matter of fact, that's one of the long-term, looking at whatever we can do together, but it doesn't appear from what we know now from the city's plan and what we know now from our plan that the two could mesh and come back with some tremendous cost savings for either of us, which is what the focus is of our committee. And I hope I explained.
Concerns? Thank you, ma'am. It's time, Mr. Doyle, are you ready? Okay, we'll go ahead into an exec. Could I have a hearing?
Motion is needed to go into a closed meeting to discuss the following items and subjects pursuant to Section 2.2-3711 of the Code of Virginia 1950 as amended. The discussion and or consideration of the personnel report and related information. Number 2, the discussion and or consideration of the pupil personnel report and related information. Number 3, the discussion and or consideration of student appeal numbers 1516-3 and 1516-4. And number 4, consultation with legal counsel employed by the school board regarding a specific legal matter requiring the provision of legal advice by counsel and more specifically as relates to Suffolk City School Board versus Terry A. Rose as parent and next of friend of CR, and B, United States of America versus School Board of the City of Suffolk, all of which is authorized by Section 2.2-3711, 1, 2, and 7 of the Code of Virginia 1950 as amended.
So move.
Second.
If board members will please vote using the voting in front of their places. Motion carried.
Turn to the empty room, please.